Okay, good afternoon, everyone. Nice to see so many people this afternoon and welcome to Mental Health Advocacy Day and Awareness Day here in the State House. And thank you all for coming to be here in our committee this afternoon. So welcome to the House Human Services Committee. And welcome to our witnesses. We're going to take a moment and go around the room, both around the table and then around the outside of the room so people can introduce themselves, and then we'll turn it over to you. Okay. I'm Teresa Wood. I'm from Waterbury, and I also represent Bolton, Buellscore, and Fleet.
And I am Jubilee McGill from Bridgeport and also represent Middlebury, New Haven, and Wadebridge.
Hi, I'm Representative Cole from Hartford.
Hello, I'm Zahn Eastis from Guilford. I serve Guilford and Vernon.
Good afternoon, I'm Todd Nielsen, I represent Brandon and Firestaff.
Hi, Doug Bishop. I represent Colchester, or half of it anyway.
Right.
I got a piece of Milton. I'm Brenda Steady, East Milton, Westford.
Hi, good afternoon, Representative Eric McGuire, Rutland City.
Hi, good afternoon. Dan Noyes. I represent Belvedere, Johnson, Wolcott, and Hyde Park.
I'm in the nick of time. And Donnie from Northfield, also represent Berlin.
And then we'll start here and go all the way around the room.
Sure. Ms. Joan Howland. I work for the Youth Development Program at Elevate Youth Services in Berlin and personal experience.
Hi, I'm Zoe Sauter. I also work at Elevate Youth Services for the Vermont Youth Development Program in Berlin and also have experience with mental health. So.
These are my coworkers.
Sure. I'm Kathy McNabb. I'm a Norwich intern. I'm M. I'm an intern with the Execs in the Administrative.
Okay.
Oh, nice.
Around to this side.
I'm Marley Cowden. I'm a medical social worker at Essex Pediatrics.
Hi, I'm Carter Bradshaw. I'm a mental health coordinator at Essex Pediatrics. And I'm Maggie Hutchinson, and I'm the service coordinator for peer services at Northwestern Counseling and Support Services, and also have experience with mental health struggles.
And I'm Lori Morse, committee assistant.
Great. Well, welcome everyone to House Human Services. And today we are wanting to learn more about what's happening both at UVM and around the state. And so we're very happy to have our witnesses with us today. So I'm going to turn over the floor to you if you want to introduce yourselves, and then floor is all yours.
Sure. All right. Well, I'm Anna Marie Ciafari. I am the director of the Master of Science in Clinical Mental Health Counseling at Vermont State University. And I'm Michelle Roush, the assistant director and student advisor for the same program. So we work with all of our students statewide in Vermont.
Great. I'm still having a hard time with training my brain to Vermont State University.
I know. Yeah. Absolutely. Well,
So welcome.
Thank you. Well, so I thought what we'd do today, and please let us know if any of this is repetitive and we'll do less, right? So tell you a little bit about who we are and the students that we have statewide. And then about the impact, we're really here mostly to say thank you because the legislature first funded critical occupation scholarships and then the VSAC mental health loan forgiveness program for the mental health workforce. Both of those have helped double enrollment in our programs over the last 3 years. So that's my main point. You've now heard it. But I thought I'd just
Feel free to say it again.
I'll say it again. I will.
I wasn't in the last session, so I can't take any credit.
You sound like the commissioner from Dale. Yeah, the other day he was like reaping all the praises and then wasn't here.
Yeah.
All good.
Well, we of course have an
body anyway, so you know.
We also have an ask because the mental health loan forgiveness program is only funded for 1 year. So we wanted you to know about the impact and let you know what it's done so far and let you know what our students are asking for the future. And Michelle has some student stories. We will follow up with written testimony.
Okay, thank you. I was just gonna ask.
Yeah, that has actual numbers because I'm just going to speak in a relaxed way today. And then Michelle has some student stories that we'll leave with you, but we'll also send those along. All right.
Thank you.
All right. So in terms of who we are, we represent the graduate counseling department at Vermont State University. There are actually there are two programs right now, but what they really are is two sister programs with different delivery formats. So one is the MA in counseling on campus. That's the traditional Johnson program that has been going for over 40 years. And it serves adult learners primarily in an more like the traditional a la carte model. You can take courses on the weekends, you can take them evenings. There's some face-to-face class where people can Zoom in, et cetera. Our program is an all weekend format program. We were at Trinity College. When they closed, we went to Southern New Hampshire University. And then in 2018, when Southern New Hampshire University put its program completely online, Vermont State Colleges said, would you like to come back? And we said we would. So we were delighted to join the suite of counseling programs. We have a very similar emphasis, which I'm going to tell you about, between the two programs. But our program is 1 weekend a month across the calendar year. All classes are 1 weekend a month across the calendar year, either in person in Williston or on Zoom. And what that means is that we really serve students statewide. And you will see that in the stories. We have students from Rutland, Stratford, Bennington, Northeast Hingham, and Chittenden County, et cetera. So that's really helped increase our access statewide. Both programs have an integrated approach to mental health and substance use counseling. So our students become both licensed mental health counselors and licensed alcohol and drug counselors when they're done. And we think that's important because people don't come in boxes. Both have a commitment really to working with the adult, with community systems of care. So we try to keep very close connections with our designated agencies, our peer agents, organizations that serve people with lived experience, and NAMI and others. I think what's unique, so the critical occupations and the VSAC forgivable loan program, what's unique about those, we've always served career people in mental health, already working in mental health, who wanted to increase their credentials. And I know that the designated agencies have some workforce funds for that, and we highly support that because that's a big chunk of our student body. But the critical occupations and now the forgivable loan allowed a lot of people who would always want to be mental health counselors to become mental health counselors, a lot of career changers. So people from nursing, education, health coaches, massage therapists, artists who always wanted to become mental health counselors to start their graduate careers. That's mostly what I wanted to know about our programs. And then in terms of the critical occupation scholarships and the forgivable loan program. So if I just use snapshots of enrollments in the fall, if you looked at the fall of 2018 in the campus program in Johnson, there were 80 to 85 students. We joined the school in 2018. So by the spring of 2019, we had doubled their number of Vermonters. That was about 130 Vermonters. We had some students in other states, but about 130 Vermonters. Between 2019 and 2014, that number grew to 243 Vermonters. And I actually think this spring, and these aren't the formal numbers because we started with that 243, thought about spring admissions, continuing education, people in the school counseling program who are not counted in that, and people getting certificates of advanced graduate study. We probably have more like 300 Vermonters across the two programs. So really grew from 100 to 300 students with the help of that scholarship funding. Right?
I think maybe you just answered this question. I want to make sure I understood it because I was wondering about the program that you're specifically providing and whether or not it was impacting schools and mental health in schools. But it sounds like there's a separate program for mental health school counselors.
Yes, and I think that would be a good question for VSAC or to think about when the VSAC, so as the critical occupations scholarships that were funded during the pandemic went away, the VSAC mental health forgivable loan program came online. It serves, I think it's a very well-designed program because it serves people studying in counseling, social work, psychology, substance use counseling, any of the mental health disciplines. And the other thing that I think is really good about it is it requires 1 year of work post licensure for every year of tuition loan forgiveness that you receive. So our program alone takes 3 to 3.5 years because it's 60 credits to become a counselor. People then have to do another 2 years of postmaster's practice to be licensed. And then they have to give a year for each of service for each year they want forgiven of their loan. So that's 8 years you're really talking about that people are in the mental health workforce in Vermont. So that's why I say I think that's a really well-designed program. When that was funded, it left out school counselors. And we did wonder about that. There was a school counseling program on campus in Johnson. Our program also trains people to be school clinicians. So they're not in the guidance role, but they are in schools as mental health clinicians. And we know it's a very needed area, right? So the pandemic money said mental health, I think somehow, and I don't know why the VSAC loan, that would be a question for VSAC, but, and there may be other funding for school counselors, but the numbers we're talking about don't include the school counseling students. They do include our students that do work in schools in different ways. So
And do you know how many of those are either, or I guess a breakout of how many are people who are working in the designated and specialized service agencies and continuing their education? How many, well, I guess won't know how many people are actually, choose that career path after they complete your program.
Right. That I don't know. We certainly want to start doing, I had alumni data, but it's old now. And that alumni data suggested that most of our students from Vermont stayed in Vermont. And many of our students went into the designated agencies, but I don't have good numbers about that right now. We will start collecting that. I would say we've had about 30 to 50 graduates per year that got some funding over the last 3 years. And so we're going to want to do an alumni survey with them to see where they go. We work very hard. We don't allow our students to do their practicum and internship, which is 700 hours in private practice. We feel like they get a lot of good variety of training and supervision in the designated agencies. And we hope that opens their eyes to the wide variety of roles that are available in the designated agencies. We certainly know anecdotally, and you'll see in the stories, that many of our students are working in the designated agencies now. Some of our alumni, all of you will know Beth Goss at the Howard Center, who's a clinical leader. A lot of them are clinicians. One of our students only graduated a couple of years ago. She's head of emergency services at CSAC. So it's more anecdotal than numbers, and we definitely will be following up, trying to, track our alumni. We do know that the 85% in the past pursued licensure. And usually if people are pursuing licensure in Vermont, they want to stay in Vermont, but I can't say that they do stay in Vermont. Sarah Squirrel was one of our alumni. You probably all know
She's
her.
in Maine now, though.
She's in Maine, though. We can't count her. She moved. I know.
Bad example, Anthony.
Oh, sorry about that. Just someone I love, so she What you mean?
I mean, I think I think the investment that we made was partly because of hearing about the workforce shortages in the designated and specialized service agencies as well as the schools.
Yes.
And so it will be important, I think, to have graduate and alumni data to sort of make the argument about continuing support for
The program that folks stay in that. Yeah, that makes perfect sense to us. And I think that, and we will hope to have that as they're a couple of years out now. People are just starting to get licensed to, I'm thinking about our cohorts. We used to start 1 or 2 a year. Now we have 9 going. I think it was our 16th cohort, Vermont 16, that benefited from the money. And they graduated a couple of years ago. So we can start to ask, are you licensed? What are you doing? Of them.
Yeah.
Sure. I think that will be important to see. I think we did attract more students whose own experience was private mental health treatment with the money that allowed people who are career changers to come in. So we have a broader mix of people who are already working at the designated agencies and who maybe didn't have any experience working in mental health at all. So it will be interesting to see what happens with those alumni. But again, we're hoping we get them connected and interested in working in the public systems. So, yeah. I mean, the last thing I have are just a few numbers for you from VSAC, which is, as the critical occupations ended and VSAC started, the first year of the mental health loan forgiveness program, forgivable loan program, they funded about 111 people. And then this past year, they funded 53. And I think what they realized was there were people who had gotten funding for their first year, and then they were going to come back and ask for funding for their second year. And so almost all the funds were gone by the time new people applied. So they had 150 applicants that they could not award. So we just wanted you to know that probably, and next year, there will probably be a dip of about $1 million in terms of what was available to people in scholarship. So if the loan forgiveness isn't funded, yeah.
So, but they did fund the people looking for a second year of assistance. Is that what you're saying? That's why there was.
Everybody applied and they funded some who were looking for a second year and some who were brand new. And I think you would have to ask them, but I think it had to do with when you got your application in. And by August, because the federal financial aid information was released late, they had to rush in August to review people. And so folks hadn't heard until the end of August if they were getting funding, and a lot of people were refused at that point. So I know definitely some of our students who were funded for 1 year were not funded for the second year of their program.
Representative Bishop.
I'm sorry, just for clarification, those VSAC numbers related to critical occupation scholarships or
No.
loan forgiveness?
Loan
Loan
forgiveness.
forgiveness.
Yeah. And we'll put it in written testimony so that I don't misspeak.
Yep.
And we'll have someone at the college read it.
Fact checking.
So,
Thank you. Appreciate that. And just taking a look at want to make sure we have time for the stories because we do have
Yes.
other witnesses at 1:30. So I want to make sure you have time for your stories.
Yeah, absolutely. So, we asked some of our students from around the state because of the way that we deliver the program weekend format in the winter months synchronously on Zoom, and in spring, summer, and fall, meeting face-to-face in person at the Williston campus. It does allow students from all over the state to access the degree because we have students from Bennington, Brattleboro, Northeast Kingdom, all over. And many of them have spoken to that they couldn't have started the degree. It'd been something that they'd wanted to do for a long time that they just couldn't, they had young families or their own undergraduate tuition they were still paying off, and that the financial support really helped them. So I'll just read, and I will send this along as well, but I'll read some of the snapshots of some of our students who are current students and alumni. So Ezra Demers is he'll be graduating in the spring of 26. He's currently finishing up an internship at NFI, working with the family-based supports program. And he said, I received a critical occupations grant for my first 2 years of the clinical mental health counseling program. The grant allowed me to pursue my degree. It was a foundational component of me accessing this next step in my education. I don't believe I would have been able to start graduate school without the grant. It has made an enormous difference for me. It gave me the chance to step up into a new field that I had been interested in pursuing, but had been shying away from taking the steps because of the high cost of going back to school. Critical Occupations Grant opened up a doorway. I applied for the VSAC Forgivable Loan Program in the spring of 2024, but did not receive it due to not applying early enough. Part of what happened was the students who had been receiving the critical occupations funding, that was voted on each year, right? And so students didn't know if it was going to continue or not until after everything had been voted on. And so by then it was definitely too late to apply for the VSAC. So he's hoping that it will be available again and will apply as soon as possible. As someone who plans to remain in Vermont after graduating, the forgivable loan would make a pivotal difference for this final year of my classes. The ability to take out a loan that I would work off over time would not have to pay back would be a huge boost as I get ready to enter a new career as a clinician and work towards licensure. Thank you for considering the Forgivable Loan Program. And he goes on to say more, but I'll just move on to another student so that because you'll get these when we submit our written testimony. A student alumni who is now working as the coordinator of emergency services at CSAC. She's filling a role that includes administrative leadership, clinical crisis work, and also a small caseload of individual outpatient therapy as clients at the agency. Jen Stefani said, I did not use the funding she didn't access the critical occupations or the VSAC forgivable loans because she graduated before the VSAC forgivable loan program was available as well. She's seeing that the funding is a huge factor in her non-master's level staff decisions about whether they can move up in higher level roles by pursuing education and advance their careers in counseling. Many people would be more likely to pursue this education if they believe they could make their costs and benefits balance. Entry-level agency salaries for people with master's degree are low when you consider the time and expense of the required education. Funding assistant makes it more likely that a person would see a career at any agency as a viable choice. Dottie Moffett, who is a current student and the projected graduation of December of 2026 from White River Junction. Oh, I forgot to say, Jennifer Stefani is from Addison. Ezra is from the Burlington, Winooski area. And Dottie, just trying to skip to so she received an email in the fall of 2022 inviting her for an informational meeting about the master's program in clinical mental health. The critical occupations grant made it possible for me to join the program. Many of my cohort members also began this program because of the available grant. In an extremely short-staffed and underpaid field, the grant benefits and forgivable loan programs allow more people to enter the mental health field. She's currently working as a licensed drug and alcohol counselor in New Hampshire because she lives on the border, equal to the LADC in Vermont, and she's a rostered psychotherapist in Vermont. She's worked for 5 years providing inpatient therapy and currently working outpatient at Counseling Associates. There's a critical need for people to be able to access immediate treatment and not have to wait for over a month to see a therapist or to get an inpatient bed. I'm getting my master's degree partly to teach courses and to bring more people into the mental health substance use field. I'm proud to be an LADC in Vermont and have had the honor of working with amazing clients.
And I think she hosts a candlelight vigil. She's in her home community every year around the opioid crisis. So that's who Dottie is.
Yeah.
And she said to us that her telehealth clients study in the Vermont. So she's someone who's both done public and private work and plans to, I think.
Yeah. This is an example of a student who is making a career change. She's been an outstanding student and intern in the program. She's Hannah Cusio, who is an expected spring of 26 graduate from Essex Junction. The Critical Occupations Grant and VSAC Forgivable Loan Program have enabled me to make a meaningful career change from banking to mental health. I'm currently intervening in an intensive outpatient setting. Interviewing. Intensive outpatient setting in Chittenden County. As a parent of small children, I would not have been able to enter the field without these programs. This funding, together with Vermont State University's MS in Clinical Mental Health, which is designed for adult learners, have made it possible for me to access graduate school. Thank you for investing in Vermont's mental health workforce. It has made a difference. And, I will send them all to you all with our written testimony. There are a few more, but that just to give you a flavor of the impact that these funding opportunities have made for our students and for the mental health workforce.
Yeah, our students vary between 25 and an age they would prefer we not tell you, my age. But they are primarily mature folks. And I think that's part of why we're hopeful that they're picking our programs because they are settled in Vermont and they want to continue to contribute to their community in Vermont. And we definitely will be following up on what they do in the future, but we're very proud of the work that our alumni do. So I think that's,
Well,
we
it
just
sounds
want
like
to
you've
say
done
thanks.
amazing work to increase the breadth of the program and the reach of the program, so that more Vermonters have access to higher education in this area, it's great. Yeah.
I think we're part of a great suite of counseling programs. So and you have some folks, you may have some folks here. who- Yes. So, yeah. Yes.
Big
So,
nods.
yes.
Are there any questions for the witnesses? Representative Noyes?
Yeah, we often hear about a big need for elder care clinicians and people working with older Vermonters in mental health care. Do you have any focus on that, or do you talk? I'm just,
We do, actually.
We actually do. Our program in particular has two specializations, one in working with children, youth, and families, and one in working with adults. People are trained to work across the lifespan, but the main reason we created those specializations is so that we could add some specialty courses that everybody took. And one of those is in working with folks who are aging, with elders in our program. In the other program, David Hutchinson, who used to be the head of the program for many years, teaches an ongoing course in aging. So both programs address the needs of older Vermonters. Yeah,
thank you.
and it is unique. And also early childhood. We try to, we have a regular human development course, and then we have an early childhood and infant mental course. Great.
Any other questions? Well, thank you both for being here today, and especially on this particular day. And it's always nice to sort of close the loop on a legislative action that happened in previous years and to see the impact of that.
We had a great impact for us, and we want to thank you for that. Yeah.
That's it's very helpful to see, and expanding our mental health workforce is really something that the body has concentrated on in the last few years. So thank you for sharing that information and the success, and we'll see what happens for continuation,
I
right?
know there's so much going on right now, but yeah.
Well, and I'm certain that probably somebody is talking to the Commerce and Economic Development people downstairs. If you haven't, then you should.
Okay.
Because they're the folks who make recommendations about workforce training programs and scholarships like that. So that originally, so anyways, just putting a little plug in.
Thank you. Good to know.
So yes, and I'm sorry, we don't usually take testimony from around the side of the room, but sure, go ahead.
We were encouraged in our meeting this morning that as the public, we could speak up in the committee meetings.
Well, it's not actually, because we have defined testimony, we have defined witnesses, but today I've been allowing an exception, so go for it.
Okay. I was just wondering, I actually do lowercase s social work right now, but I'm in the process of applying to master's in social work programs, and I was hoping to use that funding, the forgivable scholarship. And so we kind of talked about the past, so I was wondering if there was any kind of update on what the future looks like, because we've kind of heard what happened in the past, but kind of what is the next step, or where's the plan to go?
It's exactly what I was telling the witnesses, to make sure that they make a stop down in commerce and economic development, because that's where the state's workforce issues are handled, and things like the program that we're just talking about. That's where a recommendation for continuing the funding would come from. Of course, we all have a role sitting around the table on whether we vote for it or not, but they're the ones who would recommend that policy to and the funding for that policy to the appropriations committee. And so it's a process, but the place to really start is also sharing the data that you folks just shared with us.
Yes.
With commerce and economic development, because that will be really important. And you might actually just go ahead and reach out to them about it, because they too would like to hear about the results of the investments that they had recommended in the program they recommended. So I think that would be a good idea. So that's where it was. Thanks for asking that question. That's where it will go.
Would you like us to leave you the stories?
If you're gonna give us to them digitally, that would, we'll
send
post them on our website.
Send them a report. All
Yeah,
right. Thanks.
that sounds
great.
Thank
you all so much.
Thank you. Thank you so much.
Breaking news is, Trump has rescinded his order freezing all federal grants.
After the court froze it.
After the court froze it, right?
Thank you all for the very important work that you do.
Thank you all so much. All righty, take care. Okay, members, we are now going to move back to the subject we were talking about this morning, which is H13 on act relating to Medicaid payment rates for home and community-based services. So we have 3 witnesses, all of whom are here, so thank you. We have Mary Hayden from the Vermont Association of Area Agencies on Aging, Jill Olson from the VNAs of Vermont, and I see Eric Fritz has joined us from the Vermont Association of Adult Day Services. So who wants to go first? And do you all have any materials that you want to share? Maybe you already did, and I just have to refresh my committee page. Yep, that works. Okay, you do. Old school. Yeah, well, you can ask people if they want, but only go in one direction if you don't want it. Causes too much confusion by this end if it's coming from both places. Some people do like a piece of paper, but it is on your webpage too.
I like paper.
Okay.
Got some paper for you, if you like paper.
So, and since all 3 of you are here, we won't have to do this 3 times, but this is your first time before the committee this year. So this is our, I've lost count, 4th or 5th time we've introduced ourselves today. But I'm Teresa Wood from Waterbury, and I also serve Bolton, Buellscore, and Huntington.
And Donahue from Northfield, also representing Berlin.
Hi, good afternoon. I'm Dan Noyes. I represent Hyde Park, Johnson, Belvedere, and Woolkit.
Hi, good afternoon, Representative Eric McGuire, I represent Rutland City.
Introduce.
Oh, Brenda Steady, East Milton, Westford.
Jeff Bishop, Colchester.
Good afternoon, Todd Nielsen, Brandon Forrester.
My name is Zon Eastis. I serve Guilford and Vernon.
I'm Esme and I represent Hartford.
Jubilee McGill, Bridgeport, Weybridge.
Mary, Ray Garofalo, Essex and Metro Junction.
Mary was the assistant.
And you get to do it twice.
Okay. So I'm Abby Hutchinson. I work for Northwestern Counseling and Support Services and 5 years. Hey, I'm Carter Bradshaw. I'm the mental health coordinator at Essex Pediatrics.
I'm Marlene Howden. I'm the medical social worker at Essex Pediatrics.
Jill Olson. I'm the executive director of the VNAs abroad. And I'm the intern at
I'm Catherine McNabb and I'm a Norwich intern at the Savings.
I'm Erin Wolpe. I'm associate at MMR and we represent the VNAs and VHCA group.
I'm Charlie Shepard, a student at Visual Bears College. So this is analysis.
Great. And why don't we go to you too, Eric, on Zoom.
Sure. So Eric Fritz, Executive Director, Scotland House Adult Daycare, which is located in Quechee. And I'm also the current president of the Vermont Association of Adult Day Services.
Okay. Well, thank you all for being here. And Mary, I'll turn it over to you to introduce yourself and the floor is yours.
Thank you. For the record, Mary Hayden, I'm the Executive Director for the Vermont Association of Area Agencies on Aging. You can call us V4A, that's easier. Before I get into discussing H13 today, I know that many of you are new, and I wanted to do a brief sort of overview of what the Area Agencies on Aging do. So there's 5 agencies in the state that covering the entire state, and AAAs are experts at coordinating free social and health-related supports, which enable older Vermonters and individuals with disabilities to age well at home and in the community. So services include, for example, case management, establishing long-term support services, coordination for our clients, administration of the state's older Vermonter nutrition programs, such as Meals on Wheels and community meals, caregiver supports, information and referrals, helpline, Medicare, and health insurance counseling, education as well, outreach and application assistance for benefits, such as state pharmacy, Medicare low-income savings, housing, fuel assistance, Three Squares Vermont, and also wellness activities and programs. Some case management, home-delivered meals, and caregiver services are provided under Medicaid and/or the Older Americans Act, and other services come under federal grants that are received through DCF Economic Services. We're regulated primarily by DAIL at the, at the state level. Excuse me again. So V4A has been serving on something called the Long-Term Care Crisis Coalition for a number of years now. I hope you're familiar with the coalition and you received their most recent letter, which I also distributed to you just in case. We fully support the coalition's request to fully implement increases for home-based choices for care and enhanced residential care that were set forth in DVHA's 2023 rate study, as well as the inflationary adjustment to all long care reimbursement rates in the FY26 budget. So that's just to say what our coalition is requesting in the budget. But we're here today about H13, and the AAAs strongly support the underlying purpose of H13, requiring the Secretary of Human Services to determine reasonable and adequate Medicaid payment rates for providers of home and community-based services. So the AAAs are Medicaid providers for case management services for in the Choices for Care program. In that capacity, the AAAs qualify older Vermonters for clinical and financial eligibility to receive these services and create long-term care plans to support clients to be able to stay at home or in the setting of their choice. And these services include home health, personal care, moderate direct care services, homemaking and chore services, and much needed respite for family caregivers, including services through adult day centers. The rates of pay that these workers receive impact the AAA's ability to hire and retain our own staff, as well as to find workers needed to fulfill the long-term care plans for older Vermonters. So the home and community-based system of care was created for people to receive the services they need while they're living in the setting of their choice, whether at home or in another community setting. And that system was supposed to create cost savings across the long-term care system to avoid a more expensive healthcare intervention, such as nursing home placements and hospital admissions. But the historical underfunding of this workforce and this worker shortage has brought us nearly to the brink of a crisis. Other payers in our system do benefit from rate setting, and I think you heard about that this morning, and putting home and community-based providers and those needing their services in an unfair position. So I know that this morning there was testimony about the Medicaid services across the state, the unknowables that we're facing in light of threatened cuts, as well as the need for equity and parity across the state for these services. I do think, and I want to point out though, that I think we're facing a parity and equity issue now with these services, which are not benefiting from the rate studies that some other payers are benefiting from. And that's not to say, as was also stated this morning during testimony, this is not a guarantee or forcing rate increases, but it's the best way to inform you all about where rates should be based on objective methodological means to determine those rates, so that you're informed and you're aware that if there is a significant gap between what we actually pay and what we should be paying. So as AAAs, we've had a front row seat to observing the consequences to Vermonters when these long-term care services that we create cannot be fulfilled or are delayed due to a shortage of workers who are available to deliver the services under that plan. So clients can slide into needing more serious and costly healthcare interventions if services are delayed. Some clients have waited years for services, and that can result in deterioration in health and in some cases, the loss of housing. So not only are some older Vermonters denied the choice of where to live when that happens, but the severe workforce shortage also overburdens our healthcare system, which is unable to absorb that strain. Aligning these rates of pay for these critical services with market realities through annual rate studies will go a long way towards improving older and disabled Vermonters' access to home and community-based services. And again, I just want to emphasize that this would not require you to increase rates, but it would require the state to study the rates and determine what they should be in alignment with the market. That's it. Thank you for the opportunity. It's easy when you're supporting it.
Yeah, I didn't figure we were gonna have a lot of detractors on this particular bill, which is maybe why we're starting with this one. But let's see if there are questions. I'll just start off with a question. So one of the things, and this kind of, I think, probably goes to the underpinning of there not being really any wiggle room among the area agencies on aging in terms of their ability to sometimes be nimble when the caseload, when you experience higher caseload demand. So one of the things that popped up that I heard about was during the open enrollment period and the inability of the providers to, manage all of because there were so many more Vermonters this year who were being impacted because there were products that were being dropped. And so a lot of people had to find other products and were kind of frantic about trying to find them. So what impact would something like H13 have on the ability of the area agencies on aging to, I guess what I would say is kind of meet a temporary increased demand like that, for instance?
Yeah, I mean, you're talking about the SHIP program, what we refer to as
state health
insurance, state health insurance assistance program, which is,
I know it's federally funded.
It's federally funded, and it's funding directly from ACL through jail, then it's passed on to us. And so it really is straining the system, as you indicated, given the increasing, demographic, increasing population, and other events that have sort of created a perfect storm for the programs, such as, Medicaid unwinding, and then a number of commercial insurance plans leaving the market, and notification about that just prior to the start of the open enrollment period. And so that kind of cascaded into the need to schedule many more appointments, but without increasing our staff or volunteer capacity to respond to that. So that's what you're alluding to. I think for, whether we could, whether increasing the rates of pay for choices of care work would impact on that. I don't know that we can make that connection because they're very different funding sources. And we actually have cross-trained other staff to help out during open enrollment periods or periods of, where it's very, where it's the caseloads get much higher. I don't know that we can really make the case.
You're not thinking that it will make a difference?
I think our main concern with SHIP is that we've kind of exhausted the non-economic ways to address this without increased funding for paid staff capacity, like cross-training staff, increasing our outreach to people who are capable of self-enrolling, increasing the initial intake work that our INA staff can do, for example. We're looking at using our learning and education platform that we invest in called Get Set Up, which now has a wide range of Medicare courses, to see if we can leverage that to help with the program, to work more with community partners. We're sort of exhausting a lot to try to remedy the situation and plan for the next period of open enrollment.
And as we heard this morning, lot of uncertainty about what's going to happen at the federal level. So who knows if SHIP will even be around.
Yeah, we're getting some alarming messages about shit
Yeah.
today.
Yeah.
It's been on the chopping block before, and we've saved it, but this is a whole different
Mhm.
animal, what's happening yesterday and today. I did want to also mention that for those of you, I did distribute our service map, and I encourage you to use this if you have constituents who need to reach out to us for help. It gives you more, some detailed information about what towns are covered by which, AAA. The best way to reach us is through our helpline. And if your constituents call our helpline, they will be asked to enter a zip code for themselves where they live or where their loved one lives that they're calling about. And then they get automatically routed to the correct agency. But this sort of gives you an idea in case your constituents need some help.
And use that 800 line past that. I mean, it's very helpful when constituents have questions about, various things that they may or may not be eligible for. The folks at the AAAs have a lot of knowledge about that. And
yeah, it's the best portal to get help. It's not like a customer service line where you just hit a voicemail and sort of go in circles. It's the best way to access help. So, and by as long as someone knows their zip code, then or their loved one knows their zip code. So if we have adult children calling from out of state, they need to know their, say, parents' zip code here in Vermont.
I have a quick question around, the case management services for Choices for Care. And I don't know if this is still the case, but I understood at one point at least that the area agencies on aging would be the only entity providing case management services for Choices for Care. And oftentimes what I have heard from providers in the past is that increasing the volume in a service that you already lose money on, whatever the right word is, actually is not beneficial for an agency's bottom line, because you're just increasing the disparity between what you have in terms of ending the year in the black. And since that seems to be a shift that is sort of like the train has left the track on, do you have concerns about that, absent having some sort of routine way to review the rates that are being paid?
Yeah, that's a really good question. And certainly the rates can impact on that. So we're hoping that doesn't happen. I mean, we've been working with Dale on the transition for more than 6 months now. It just started earlier than, the best laid plans, because just by its nature, when folks hear that kind of change is happening, the cases started coming over very quickly from the HHAs over to our agencies. A little different depending on the area we were dealing with, you're dealing with, but so over these months, a combination of grants from Dale to help with that transition, because that also requires that you staff up to manage those caseloads and you don't overload your staff with too many cases. And extra training and more supervision is required. So as the caseloads increase in the AAAs, which is ongoing, has been going on for at least half a year, we also are faced with staffing up to manage that and also to manage the caseloads. What we're also finding is that the cases that are coming over are more complex than we were typically dealing with prior to the transition. So we're also dealing with more acuities,
At the home health agency.
more complexities.
Yeah.
And we need to respond to that as well. So in addition to all of that, our AAAs are looking at their structure. How does their structure manage all of this and creating, say, complex case tracks as well. So all of this is happening, and And economically, it's been difficult to absorb. And because you can't just start billing right away for these new cases, you have a run up to that. And so, yeah, it's been difficult to manage on all those levels, but one of our AAAs announced in October, their transition was completely done, finished in Southwest Vermont Council on Aging. And we've also been able to hire folks over from the HHAs, which has really helped, including one supervisor. It's been a great addition to our network. So it's been difficult, but we're managing it. And at the same time, we're also upping our quality assurance because we are working on getting accredited under NCQA standards for our case management work. So it's a lot of transformation in the system right now, but your point about rates of pay certainly impacts on our ability to manage all this and have the resources to manage all that.
Representative Noyes.
You said that one of the AAAs has been able to hire staff to meet the need.
Well, more than one.
More than one.
Yeah, but one of the AAAs has completed the transition of all the cases. All the
Gotcha.
HHA cases have transitioned over to
When
that.
do you expect the rest to?
That's a good question. Some of them are pretty far along. I think they're probably between maybe 50% and 80%. So I would think within 2025.
And just kind of along that same line, I mean, what's the caseload per case manager? Like, how many people are
We
they?
want it to be 30.
30? And what is it?
Especially with the more complex cases, it's higher than 30 at a couple of the agencies. I think Dale may have a different view of that as well. So that conversation continues.
What does that mean?
It just means that I think that they would like to see higher caseloads. And so the conversation is around, how many, we would prefer 30, but also adding this complexity that we're seeing in the population. How does that impact on caseloads? So, for example, if you have seasoned case managers assigned to a complex track, for example, then what would be an appropriate caseload for those folks? Because that's going to be much more intensive work for them. So I would describe it as a dialogue and a conversation that is still going on.
Okay. Thank you.
Other questions? I think, it obviously probably should have been anticipated that they would be more complex cases, hence probably why they chose the home health agency to begin with because of the medical nature. I think, I guess I would, it's interesting to hear. We'll take more testimony as we get further into this about sort of the transitioning to conflict-free case management, how that's going from the perspective of the when things are a little bit further along the line in this session. But I'm hearing from people who are from people wanting services, I should say, that they thought they were going to get something that they're not getting when they get case management, which is things like helping them find a place to live, helping them with managing their medications, I'm not sure that the consumer perception and the Dale perception and definition are matching up. And so something for us to talk with them about as well.
I should say that some of the cases too coming over are complex. They're younger population too. And so it's adjusting to that as well.
Yeah. It's a change. It's a change.
And we're working to adjust to the change actively.
Thank you, Mary. Appreciate it.
Thank you.
Thank you, everyone.
Thank you.
Thanks for listening.
Jill, is that going to work for you, Eric, if you go after Jill? Oh, okay, thank you.
Okay, I'm gonna try sharing my goodness, it did not work in healthcare the last time I tried this. So I'm hoping, it was mostly user error, but I'm hoping.
So we have more windows. That's what makes it work better.
I had to adjust a setting. I had a whole like bouncing of sound problem, but I've adjusted a setting, so I should be not having any any sound at all. Okay, good. Let's see if I now get to the. Not blurry on my screen. There we go. Okay.
You are there.
Okay, I did it. Wow, okay. This is my new favorite committee. Okay. I am Jill Olson. I am the Executive Director of the VNAs of Vermont. So we represent home health and hospice agencies. Because this is my first time here, this session, I am going to just do a little bit, as Mary did, sort of intro and orientation about who we are, how we fit, and why we would care about this bill. But it's only a few slides, I promise. So I will get to the bill pretty quickly. So home health and hospice agencies are provide sort of 4 big buckets of service. This is how I like to think about it. And actually, the services we provide are considered in different committees. So we have medical services that we provide. That's really, I would say, our primary work is the skilled home health services when, people are in the hospital, need a nurse when they come home, or need physical therapy in the home. Really important for hospital discharges. So almost as many people go home to home health from hospitals as go to skilled nursing facilities. So without that home health skilled care, a lot of Vermonters even more Vermonters would be stuck in hospitals, unable to get home or out. We provide some preventive services, health screenings, vaccinations, and also maternal child health. We provide care at the end of life, so hospice services. So that is a holistic service that we provide in many settings. It could be in a nursing home, could be in an enhanced residential facility, any place anybody lives, they can receive hospice services. There is also one inpatient hospice in Chittenden County, so one in Vermont. And then the final thing, and this is really what this committee tends to focus on, is the long-term care that we provide under the Choices for Care program. And so I just want to make sure people understand how important this service is. I heard the testimony this morning talking about the need to focus on 4 services because of all of the uncertainty. So I just want to make sure we all get that what we're talking about is care for people who cannot take care of themselves independently. That's what we're talking about. I don't know how to get more core than that. So we take care of people at home who need help with bathing, dressing, nutrition. They could not live independently without health, and they have very few financial resources. By definition, that's what Choices for Care is. If you are on this program, by definition, you need nursing home level of clinical services, and you are out of money. So that's why you're on the program. And so to me, this is an essential service and absolutely critical. So, and in Vermont right now, that is a service provided by home health agencies, not true in most places. And I think Vermont is actually working to bring other non-medical providers into the system. We support that. We think we need that at this point. So those are our 4 big buckets of service. I talked about some of this. So we have this critical role in the health system, very vulnerable population, hospital discharges. And I think this is something else that I think is important to understand. It's a less expensive, people at home is generally less expensive for the state than to be in a facility. Now, I want to be clear. We need to fund the whole system. There is no part of the system that can fall apart. Many people move through the system. So they might spend a year or 2 at home on Choices for Care and then eventually need to move into a facility because their needs become too great. We do not support saying one part of the system should starve while other parts of the system get resources. The system has to work. And it has to, because, when you think about it from the perspective of the person getting services, I think you feel that even more viscerally. But it is still, if the more people we can keep at home, the less cost we have in the system. And it's not like a future savings. It's now, it's an immediate savings. And just to give you some idea on our numbers, I took this from some Dale data, number of individuals being served in different settings under Choices for Care. So about 2,000 in nursing home, about 1,000 from our agencies, and then just about another 1,000 doing self-directed care. So if that 1,000 people wasn't being taken care of by home health agencies, it's a lot of people for the rest of the system to absorb. So it's a critical service. There's a lot of pressures on the system right now, and I'm talking specifically about home health right now. So I just want to make sure everybody here understands we lost a home health agency last year. That is a huge deal. It didn't hurt as much as it might have because another agency was able to absorb their service area, not their organization. The agency closed, and the agency closed because they had a lot of Medicaid. That's pretty much the reason. They were they had a particularly high proportion of Medicaid revenue. It is not adequate, and they couldn't make it. So I don't know how else to say it. They couldn't make it. And so I think we should all be very grateful to the VNA and hospice of the Southwest region, which was able to step in and at this point is providing services in that community. So we've got travelers. So sometimes we need to hire traveling nurses, as you've probably all heard, it's very expensive. Travel reimbursement. So we pay for people to travel, but we don't get reimbursed directly for people to travel. So it's built into the rate. Workforce shortages, which obviously impact the cost of wages. What I always say is there is no year when I'm going to come and say it didn't get more expensive to do this. That year is never coming. Every year it will be more expensive to do this work because every year the wages will go up. Every year the benefits will get more expensive. Some years the gas goes up a lot. That's the one thing that actually sometimes does come down. But usually the federal rate doesn't come down, and that's what all of the reimbursements are based on, right? So even if the gas prices come down, it's that federal reimbursement rate that matters to home health. And then the patients are more complicated than ever before. People are living longer, a lot sicker, a lot longer, a lot sicker. And then our Medicaid reimbursement is consistently below cost. So we did some work this year with DEVA, actually. It's essentially a rate study, and we've all agreed that home health, our skilled rates are at about 67% of Medicare. So we're well below Medicare. And then we know from the rate study that we already have that choices for care rates are well below costs because we have that rate study from 2023, which it sounds like you've heard about already. I think you've heard about. Okay. So then I just want to show you this slide. This is Medicaid slide, just to understand. So this is from an organization that audits most of my members. So they have data from all over the country and the region around home health agencies. So you see what Medicaid looks like at a profitable home health agency. It's a really small part of their business. In New England, really small part of their business. Vermont, much bigger part of the pie. So that is a service that is not reimbursed at cost, and we're doing a lot of it. And that's how we've set up the system. It's partly that way because we have a designated home health system in Vermont where there are different agencies serving regions, and they are serving everyone who is eligible for the service. That's what the regulation says. I have to say it doesn't always work that way because sometimes there just isn't the workforce, but that's the concept. So home health agencies in Vermont can't say, we're going to cap our Medicaid at 5%. We're not going to,
nursing facilities can.
Almost everybody else in the system can. Hospitals can't, and we can't.
And designated agencies.
Right. But yeah, so physicians can. There are other providers that can do that. That is not one of our tools.
I hear you. I just, does that figure in Vermont, that light green, I'm not sure from what year this was, but
sorry, I should put that on the slide. It's last year.
So
this is based on audited financials, so the timeframes are a little different depending on the agency.
That pie will shift somewhat because home health agencies have been providing case management services in this pie, the one service that actually maybe paid for itself.
That's right.
And so that increase, what's going to be happening is so the states made a decision to take away a service that you were providing that actually was the only service sort of covering its own costs.
That's right.
And not addressing the reimbursement for the other services that you're required to provide, and still at under cost.
Yes, that's right.
Okay.
So the rate study that we have focused entirely on direct services. And it is now out of date, both in time, just the costs go up, but also actually there are some changes. So case managers at some agencies were also the supervisors. So Choices for Care, if you provide direct services, you're supposed to put a supervisor in a home every 60 days to monitor I actually think that's excessive. I don't think an experienced PCA needs that level of supervision. So some agencies were using case management for that function. So now they don't have a person to do that job, and there is no supervision rate. There's nothing to pay us for that. It's built into the rate. So I think that piece of that study is out of whack now because of this change. And the other piece that's changed, I'm sorry. The other piece that's changed for direct service for us is that there's still care coordination. It's really hard to go into a home and not provide care coordination, whether you're the case manager or not. And we get a lot of calls. We're open 24/7. There's a phone number you can call. So we get the calls even if we're not the case manager.
We will hear the same thing from the designated agencies about this case management, but Representative McGuire has a question.
Yeah, just quickly to go back to the comment that you made.
Yeah.
Who's regulating that? Is that the state?
Yes, the 60 days.
Yeah.
That's the state. And we are working with them to talk about whether that we can make an adjustment to that regulation.
Have they provided you any clarification or any understanding to why that's the case?
The 60 days?
Yeah.
That's been a rule that's been around for a long time. I think people worry about safety. They want to make sure that anybody who's going into the home is qualified and doing the work well. Totally fair goal.
Yeah.
It's just a question of whether you need a 60-day visit that often in order to ensure that. We would argue that there are other ways to do it.
And I would say that there's a whole big chunk of the system that's hiring their own workers and they don't have anybody.
Nobody looking. That's right.
Right. So it seems a little inconsistent.
Just to be clear, the department is willing to work with us on this. So I just want to make it clear that we're already in talks about trying to figure this out. But it is the world we live in at this moment.
Right now. Yeah. Representative Noyes.
I'm just trying to figure out why your Medicaid portion is so much larger than either New England or
Because we take everybody. That's why. Because we take them.
Right. It doesn't have to do with like our funding model around
Might have to do with the fact that we have more Medicaid in Vermont. It could be a lot of things. Yeah, but
we just been trying to utilize as much Medicaid dollars as possible by matching with state dollars.
So I haven't dug deep enough into this to give you that insight, but I can't tell the difference. I couldn't pick out of this the differences because we have designation, because of our Medicaid penetration in Vermont, because of other state policies. I'm sure there's a lot to it. I think to me, the point of this slide is to understand that the agencies that are doing financially well are not the ones who have 30% Medicaid. That's just the deal. So then we have Medicare pressures. So unlike many of our counterparts, this is mostly a good thing. We take Medicare for skilled services. So some designated agencies have almost, don't have that federal source of funding. We do. So a lot of the people we take care of in the skilled program and in the hospice program are eligible for Medicare and receiving the services under those benefits. They pay better than Medicaid for sure. Unfortunately, Medicare is cutting us. So the way the world used to work is we had Medicare margins, meaning we got more from Medicare than we spent providing the services. We had extra money from Medicare, which we could use to subsidize state programs that were underfunded. That's how it used to work. That's why it looks like this and has looked like this for so long. We don't have those margins anymore. We don't have Medicare margins the way we used to. And so there isn't a source of funds at home health agencies anymore to take care of the state shortfalls. So it's always been a subsidized program. Choices for Care has always been subsidized. What's changed is our capacity to do the subsidizing. That's what's changing. So there's a couple of sort of big problems. One is as beneficiaries migrate to Medicare Advantage, we are doing really badly on Medicare Advantage from some plans. Now, they're not all the same. Some are fine, some pay just fine. There is no federal requirement that a Medicare Advantage plan pay us the same as a Medicare plan would pay us. And some don't. Some pay us less than what Medicaid pays. And so now our best payer, in some cases, has become our worst payer. So, and the more, and we were only at, I don't know, in Vermont, maybe 20, 30% Medicare Advantage. There are some states that are at like 80. So if we get to that point where we have that many people on Medicare Advantage and those plans continue to be allowed to just simply not pay us, it's just not, this is a house of cards.
Yeah, and big push to privatize Medicare, so.
Big push to privatize. This is essentially managed care for Medicare. That's what it is. It's commercial plans and it's a Medicare. And honestly, there are parts of it that are good. What we're struggling with is the low rates, and we cannot negotiate. Addison County Home Health, it's not easy to go negotiate with a big national plan. This is not regulated in Vermont in any way, shape, or form.
Dale and say, we really need some help here.
Yeah, there's nobody to talk to.
Yeah. And it's a big, longer discussion, but
Yeah.
older Vermonters don't realize, frankly, that once they make that choice, they can't go back.
It's really hard to go back.
Yeah.
It's really hard to go back. I'm now really fun at cocktail parties. I talk to all my friends. I'm 56. My husband is 62, and I just say, whatever you're doing, do not go on Medicare Advantage. So, yeah. So we've got this Medicare base rate. They've been cutting, and let me just say, the Biden administration did not help us on this. They didn't help us. They let this happen. Started under the first Trump administration, and it continued all the way through. Nobody stopped it. Cuts to the base Medicare rate. They think they're overpaying us. They put in a new payment model. They think they're overpaying us. We do not think so. Nobody agrees. It's in the courts. It's a mess. But the result is cut. We just got another one on January 1. And then there's this looming risk of a clawback. So right now, CMS has the authority to go all the way back to January 1, 2020, when this thing went into effect, and take back every penny down to the current rate.
Wow.
So they haven't. We hope they don't, but they could, and they are allowed to, and Congress has not fixed this. So there's a lot. This is like the sort of Damocles. Okay. Age 13. So we strongly support this bill. We gotta all work from the same set of facts.
Yeah.
I mean, that's all we're asking for. We want to work from the same set of facts. We have done this successfully with DIVA, both in home health and also in Choices for Care. It worked well. And no matter what our pressures are, we've got to know what we're doing, I think. And I also think that you need to understand what you're deciding when you decide stuff. And so if you're saying we've decided that this year we're going to spend money on housing and childcare, and we're not going to spend money on long-term care, and then next year I say I have 2 members who have decided they can no longer afford to provide this service, I want you to understand why that happened. So I think it's really important that we have information, and also I want to advocate from a place of understanding, do my members need this? Like, are they? I don't know. It's not, I'm a lobbyist. It's hard to know what the numbers are. We really have to work with this, either the cost structure or on long-term or on skilled home health, we compare to Medicare. So some way so that it's not just sort of us saying we need something. We're actually able to be more objective about what and why we're asking for. So we feel pretty strongly about this.
Purpose of age 13.
Yes.
Yeah.
Yep. So we strongly support it.
And as I mentioned to the witnesses this morning, that not next week, but the week after, we'll probably be getting into markup of the bill. And, we've already thought about some potential changes. So if you have areas, and I should say this to you too, Mary, if you have areas that you think could be more clear, like I think the definition of home and community-based services might be, please do be in contact with us, and whatever you send to us, you can feel free to CC to Jen Carby at Legislative Council. That will be helpful.
Absolutely. Thank you.
That was for you too, Fritz up there. So are there any other questions for Jill on this topic at this point? All right.
Great. Thank you so much. Thanks for the time. I appreciate the opportunity.
Okay, Eric.
Good afternoon, everyone. Thank you.
Welcome.
And thank you for this opportunity to testify. And thank you, Representative Noyes and Representative Wood, for introducing this bill. Again, my name is Eric Fritz. I'm the Executive Director of Scotland House Adult Daycare, which is located in Queechee. Hi, Esme. And I'm also the current president of the Vermont Association of Adult Day Services, also known as VADS. And I'm here as the representative of VADS to support H13. So again, like my predecessors, for those of you that aren't familiar with adult daycare, I'll just give you a little information on who we are and what we do. So there are 11 adult daycare centers around Vermont. Before the pandemic, there were 14 centers. 3 of them closed. Interestingly enough, the 3 areas where programs closed were in the Burlington area, the Rutland area, and the Montpelier-Barre area. So 3 of our biggest population centers. The good news is there are efforts underway for programs to reopen in the Barre, Montpelier area and the Rutland area. And I just recently found out that there's also a group in the Burlington area, I think in Winooski, that are looking at hopefully getting programs up and going again in those areas. So adult day centers provide a safe and supportive environment where people can come during the day to receive a range of professional health, social, and therapeutic services, as well as a nutritious meal and valuable social interaction. Adult day services also provide respite, support, and education to family members and caregivers. Adult day centers provide on-site healthcare services, including nursing care, social work and counseling services, and more. Each program is different, but we all share a common focus on ensuring that our participants are well cared for and supported while having a fun and stimulating day in a loving and respectful environment. If you'd like to learn more, and I really do encourage this about adult day care, please visit our website, vermontadultday.org. There's a really cool video, and it gives a really nice picture of who we are and what we do. 2 years ago, we were greatly appreciative when the legislature increased our Medicaid reimbursement to $25 an hour. And I'll just say, if that had not happened, almost definitely more programs would have closed by now. So it really did save us. While the increase has helped with increasing our ability to pay our staff a higher wage, like all the other folks you've heard from today, we're still struggling with the labor shortage, and it is keeping most of us from operating still at full capacity because of that labor shortage. And we're also, like everybody else, still struggling to cover our constantly increasing expenses of operation. H13 will definitely help, especially the annual review of Medicaid payment rates, as well as annual inflation increases. And finally, we also hope that the committee will support in fiscal year 2020, in the fiscal 2026 budget, the full implementation of the increases for home-based choices for care services and enhanced residential care described in the February 2023 DEVA rate study. So that's my statement. I'd be welcome to take questions if anyone has any.
Thank you, Eric. And thank you. You actually provided the link to the study. right here. We've been talking about it, and Lori, our committee assistant, had actually already included it on our webpage as well. Go ahead, Rep. Noyes.
So thinking around this H13 and looking at calculating the rates, I know that with adult days, when individuals don't show up, whether it's because of the weather or because they don't feel well or they have doctor's appointments or whatever it is, you don't get paid. Correct. Is there a way to bring that into this bill to really think about that as we work on coming up with your rates?
I think the problem there is that Medicaid regulation, what you're going to do is run into Medicaid regulation that will not allow Medicaid to pay for services that are not given. So, and I'll just give you a little stat here. So, we as a group at VADS, we calculated our lost revenue for the first 6 months of this fiscal year for, folks that haven't shown up and therefore we don't get paid for. As a group, for all 11 of us, it's almost $900,000.
Mm-hmm.
Yeah. So,
That's-
obviously, that's, we're going to talk almost $2 million of lost revenue to the system because we don't get paid when folks don't show up. And they don't show up, for a variety of reasons. They're sick, the weather, transportation barriers, all kinds of things. So we actually are going to be asking the legislature for some help in this area, but it's a separate ask from the general fund just to offset some of those losses.
So this is actually something the legislature tried to work on, and at one point, through your advocacy efforts in the State House here, I'm looking over here at your rep, we were told that you were just fine with the way the reimbursement system was set up. You, not meaning you personally, Eric, but that the programs were, because there are actually ways to modify the rate structure that include allowed absences. For instance, we pay Medicaid rates based upon for nursing homes based on 80% occupancy. So they're not required to be at full occupancy in order to pay the rates. So there are ways to work that into the Medicaid reimbursement. And we had actually wanted to put language in the budget bill that when we were negotiating with VADS about this, probably prior to you being president, that people didn't want at that time. So I really encourage continued discussions with Dale about how to modify how adult day providers are paid, and how that formula is calculated, because there are ways within Medicaid funding to account for absences, and it's not going to be unlimited. So anyways, and we'll do our part to try to encourage that on our end as well.
Okay, I appreciate that. No, we definitely would be interested in a conversation with Dale that would help us address this issue for sure. So I will carry that forward.
Okay, thanks. Other questions about Vermont adult day services? We don't refer to it as adult daycare here because people then tend to associate that with children. So we do not refer to that here as Vermont adult daycare here. Other questions for people? Yeah,
Just
go ahead.
quick around the three that closed. And you said they're working to open. Do you have any anticipation on when they are going to open? And we also included money in the budget to kind of kickstart those programs, and just wondering how that was going.
You did, and I'm most familiar with the one that's they're working on in Barrie, and I know the money that was allocated was a huge help to get them started and up and going. I think all three, and they're very different. All three are hoping to reopen their programs in 2025 or 2026 at the latest. The group in Winooski is very interesting. It's a group of folks that are immigrants to the area, and they want to open their program to specifically serve that population up there.
Interesting.
Yeah.
There are questions. Yeah, other questions for folks. And we actually, you had said three, but we had actually heard five. The three that you mentioned, and actually three in Chittenden County, and then two in Chittenden County, one in Rutland, one in Central Vermont, and a small one in Orange County or something.
Yeah, there was a small program in Orange County. But I think they, the population in that area, I'm not sure which adult day service it was able to absorb service to that area, I believe.
Okay, thanks.
Yeah.
Any other questions for Eric? All right. Thank you so much,
Okay.
Eric, and thank you for waiting
Thank you.
to go
No,
last.
no problem. I appreciate your time.
All righty. Thanks.
Thank you.
Yeah.
Thank you.
Oh,
He was like, thank
Oh,
you.
he was saying.
I thought it was a last minute
Oh.
question. and It was just, he was waving.
Okay.
No,
No, from Doug, yeah. Okay, so, sort of as I, was kind of predictable that when we had providers come in, we didn't think that we were going to get anybody to say, no, we don't want to have a regular process to review our rates. Kind of predictable in that. And, so we will continue to hear, there's a vast array of providers. We will hear from designated agencies. We are going to hear from the residential care home folks. We are also going to hear from people with lived experience and what the impact of not having a sufficient Medicaid rate, so their inability to pay their staff or to actually hire staff has had on individuals. We are also going to hear about a Supreme Court case that impacts this area that happened. The Supreme Court decision happened earlier this fall. And so Ledge Council will review that decision with us, and we will have legal aid in to explain their rationale for bringing the suit. Are there other people that you want to hear from with regard to this particular bill? And you don't have to tell me that this moment, but I will say in the next couple of days, if you think of provider groups that you don't think we've covered, or you don't think that we're going to cover, or you want to make sure that we do cover, please let me know, and we will make sure to get them in here. And if you have any, we have some folks working on arranging folks with lived experience to come in, but if you know people who have received services that are impacted by this, like in Choices for Care or in other Medicaid waiver services that you know about in your communities, we are happy to hear from people all over the state. And they don't have to come here and sit in the chair. They can testify via Zoom. They can also submit written testimony. So we pay as close attention to written testimony as we do to somebody sitting in the chair. So that's sometimes a way to help people sort of bring the experience of their constituents to the State House. All right. Anybody have any questions about that? All right. So we are not going to be meeting after floor today. I know. I felt a little guilty bringing you all back after the governor's speech yesterday. I'm sure everybody wanted to go off and, do whatever they wanted to do. But so I'm trying to make up for it today. Okay. So you can start to look, not that, I know you've got other things to do, but the governor has issued his budget. It's on the joint fiscal website. And we got links to those documents from the speaker's office this morning or last night, whenever it was, from Connor.
It's not the complete.
No, but it'll give people a sort of a sense. You're going to have the same departments that you were assigned during budget adjustment. So you can start to take a look at those budgets, and we will hear more from the administration next week on that. So, you're getting up a little early today. I know. You're hard to believe, right? Do we have an update on our committee dinner?
Yes, February 18th, Tuesday. I will send an email.
Great. Thank you. Thank you for organizing that.
We're probably going to do it at Capitol Plaza. If that's agreeable.
That's fine.
If you have objections, let me know.
Or if you have suggestions.
Yeah.
Yeah, that'd be great. Because we're always about solutions.
18.
Okay, so February
18th.
February, my calendar.
Yep. there is a couple things that'll probably be announced on the floor. There's a Vermont State Employees Association dinner tonight. I don't think that's been canceled. Has anybody seen a cancellation? I don't think so. That's at 5:15. And for people who, especially for new legislators, there is a welcome back to Montpelier, or in your case, welcome to Montpelier, that the downtown food establishments put on at the Capitol Plaza. That's going to be tomorrow evening. And they do like to know who's coming, and you're allowed to bring a guest. So hopefully you saw the email from Sid in the Sergeant at Arms office. And, so respond to that email if you're interested. It's all complimentary, except for I think you buy your own drinks. But there's always a nice array of snacks for people to have, and you get a chance to talk to the folks at the restaurants and see if they have an opportunity to put forth examples of what you might be able to eat at their restaurants. All right.